I was exceptionally interested in astronomy. Ultimately, I was accepted to MCW as a graduate student here. Then continued moving forward with MRI technology that then led to our work in the parallel imaging, the fast imaging. So it's a bit of a winding road that started with staring at stars. With this system, the fact that it makes images is amazing to me. With how weak that magnetic field is, 0.065 Tesla in comparison to 1.5 Tesla, which is the low field that we have in the clinic. The fact that this thing is actually making images is something that a decade and a half ago when I was a graduate student, I never thought would have been possible. Usually when we build an MRI, that room into which the MRI goes is engineered in a way to keep the radio frequencies of the outside world out of it. And that's what leads to these rooms being hundreds of thousands of dollars. This system runs inside of any room. It does not need that shield around it. The other really neat thing about this system is that it's powered by getting plugged into the wall. For our high field systems, hardwires into transformers here on campus, they take kilowatts of energy. This is plugged into a 120 volt outlet, which means that it can also be plugged into then a camping battery. And that can be run from an iPad. For a patient then, it opens up a whole world of imaging opportunities where you don't bring the patient to a specialized facility where the imaging occurs, but you can actually bring the facility, the system, to the patient. Throughout the world in a broader sense, infrastructure just doesn't exist in some countries to support kilowatts of power going to an advanced MR system. Power grids are just not at the same level as we see here in America. And in cases like that, there are not MR systems installed in countries. Sub-Saharan Africa is one of the great places where Hyperfine has been working because these systems, as I said, can run from a battery pack that's attached to them. And there, when malaria is a thing that needs to be screened for, which causes hydrocephalus, this system can actually go in, get that image in about 5 to 6 minutes. And with other technology that Hyperfine has developed that automatically measures the size of the ventricles inside of the brain, come up with a diagnosis as to if this patient has hydrocephalus or not. You know, everybody sees the world differently. And the training that we have in physics is to really break things down into simplifications and first principles. Take a look at the problems that are there, break them up into unique, digestible components that we can work to address and move forward. I've been looking over the years of what we can do to make MRI faster, ways to make those exams more efficient, ultimately to try and get to that level of MR scans that are as fast as CT scans. Another piece of work that I've been doing in my lab with Dr. Kevin Koch here is to work to reduce metal artifacts. When somebody is imaged with a piece of metal inside of their body, it changes the way the magnetic field is shaped. The Hyperfine right now is a head-only system. And as a head-only system, obviously we're imaging just neural. One of the challenges with the system is that there's only one sort of acquisition that it really can do, given the fact that the magnetic field is so non-homogeneous. And that's called a spin echo acquisition. It allows us to get good pictures when the magnetic field is non-homogeneous. But that then takes away a whole class of contrast that you can normally see with MR. Since they came onto the scene, trying to find ways that our work aligned with the work that they were doing. We all have been very excited from a physics standpoint about making images at really low fields. We were very interested in seeing how we could contribute. As we saw what contrasts were and were not available on these systems, we connected the dots and saw that our metal artifact reduction sequences that have been tuned up to get unique contrasts in neuroimaging that are usually not available with spin echo acquisitions, how we were able to start making those contrasts with spin echo acquisitions. Started talking to our friends at Hyperfine and saw that those contrasts were precisely the contrasts that they wanted to start seeing come into the product. So with that collaboration and that knowledge that we've built out here with the federally funded grants that we've had, we're working now in partnership with Hyperfine to transfer those technologies from the high field to the low field, address some of the lingering challenges that you have with a MRI system that you can move from room to room, and take those contrasts that we've developed here and bring them into that system to make it even more impactful for imaging in the emergency departments. I won't teach one patient how to walk again after a stroke, but perhaps the technology we're developing here can go on thousands of scanners distributed across the world, helping patients with strokes, hydrocephalus, Alzheimer's disease, dementia, start getting diagnoses that can help lead to their treatment.